So this is a very interesting HRCT high resolution CT scan of the chest, and we can see so many findings. You can simply pause and try to find or try to see the things. It will be worthwhile. So coming to the CT scan of the chest, we can very easily see that in here, this is definitely left side, this is right side, as always, and this is labeled here as well that this is R, means this is the right side, this is the left side. Now, this is a normal lung parenchyma. So, we know that X-ray by themselves, they are radiolucent or black in color, whereas bone is dense, and this is the most dense white structure. This is all bone. And soft tissue appears less dense, but it still appears radio opaque, like this is soft tissue. So, this is all fat. This is all fat that which is there. So, this is bone, which is very dense white. Calcium, bone, and blood, they appear very dense white on the CT scan. So we know that ideally in the lungs, as lung is filled with air, so air is black. So this is all lung parenchyma, which appears black on the CT scan of the chest. So anything which is white tells in the if it is in the lungs tells that there is a lesion, there is a consolidation, or there is a mass or anything. So in here, what we can see, starting from here, as this is the right lung, this is the left lung, this is the left lung, this is the right lung. So up to here, where the lungs end, we can see there is a radio opaque, or there are so many patches, white patches or radio opaque patches in the lung parenchyma. So this is the lung, we know this is the lung. So there is a homogeneous patch. See this we can very easily see. There is a homogeneous radio opaque patch in the lung parenchyma or the background of normal looking radiolucent lung. So this is a normal looking lung. So actually lung should look like this, but it is very much homogeneous. So presence of a homogeneous uh, patch on the normal looking radiolucent lung is what is pneumonia. So what we very easily can see, these are all patches which is present in this left lung as well as on the right lung as well. If we can see here, it is right lung and we can very easily see patches. So if we see, lung is divided into three lobes. Each right lung and left lung is divided into three lobes, and these three lobes are completely anatomically separated from each other. So definitely we can see left lung is involved here, 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 here. So almost all the lung lobes, whether it is upper, middle, or lower, they are involved. Same is with the right lung. So see this right lung is involved, this here right lung is involved, here the right lung is involved, here the right lung is involved, here the right lung is involved. This is the patch. The right lung is involved here, right lung is. So almost all the lobes are involved, means almost all the six lobes are involved. So there is pneumonia which is involving almost all the lobes. There is one more thing that I need to tell you, that to call it as pneumonia or consolidation, as I told the definition, the presence of the presence of air bronchogram diagnoses that it is pneumonia. Now, what is air bronchogram? Air bronchogram is a presence of air. It is a presence of air in patent bronchi. It is a presence of air in the patent bronchi uh, on a consolidation patch. So, if the patient has consolidation, consolidation means a homogeneous patch or a radiolucent lung. So the consolidation has to be there, and if there is a presence of air in the patent bronchi, it means ki it is for sure pneumonia. So if you can see here, see this black is all air. This black which we are seeing is all air, and this is a patent bronchi. This is patent bronchus. So presence of air in the patent bronchus diagnosis that this is consolidation, means diagnosis that this is a pneumonia. So we can see so many air bronchogram. Like here also we have very nice looking air bronchogram. Here also we have. So we have so many consolidation patches here also. We can very clearly say that there is pneumonia. So there is pneumonia consolidation. There is one more interesting thing in this HRCT chest is if you see the presence of these patches, there are so many patches which are subpleural based. So this is the lung. This is the pleural margin of the lung because outside the lung we have pleura, and outside the pleura we have the bone, this rib. This rib is there. This is the rib. This is the rib margin. So we have a pleura and then we have lung. So this is the lung margin, this is the pleural margin, and this is the rib margin. So a presence of typical subpleural patches means if you can see consolidation here, it is in the center. But whereas if you see here, there is a small patch which is subpleura, means very adjacent to the pleura. This is also this patch, pneumonia patch, is present at around the rib margin, which is a subpleural patch. We call it as a subpleural patch. Here also we have a subpleural consolidation, which is very, very highly suggestive of viral pneumonia. In fact, such type of subpleural patches, multiple of them, almost involving all the lobes, is highly suggestive of COVID-19, coronavirus 19. And the second most important pathology is swine flu, H1N1 or its other strains. So this patient was H1N1 positive. So when it comes to a comparison between viral pneumonia and bacterial pneumonia very commonly almost involves all the lobes, whereas bacterial pneumonia, they usually only involve one side of the mediastinum. Either it will be in the left or right. Usually the patch will be very large if it is a bacterial pneumonia. It will be almost unilateral. And if the bacterial pneumonia is this much, then the patient will be in very, very bad state. Whereas if the viral pneumonia is there like this, then patient may be comfortable even on O2 if it is a viral pneumonia. But if this much of extent is with the bacterial pneumonia, usually patient will remain pretty discomfortful. So, what is the definition of ARDS? ARDS is significant hypoxemia where either of the out of the four chest lung quadrants like this. So we have this one quadrant, second quadrant, third quadrant, and fourth quadrant. So if we have more than three quadrants of lungs involved, we call, and along with the hypoxemia definitely, we label it as ARDS. So in here, all the lung quadrants are involved. So this is a H1N1 multilobar pneumonia with ARDS, and which is very easily diagnosable by the presence of subpleural patchy consolidation with extensive bilateral lung involvement. The treatment, see, as soon as this type of pneumonia is seen, the most important things, or the most important, there are two main drugs. One is oseltamivir, which is leflunomide or fluvia, which comes into 75 milligram strength. Usually, if the patient is 50 kgs more, we can definitely give 150 milligram twice a day for 5 days. If the patient is pretty comfortable after 5 days, we can stop. Otherwise, we can continue the treatment for complete 10 days. Most of the time, if the patient have consolidation patches or the patients are comfortable, we can give 75 milligram twice a day oseltamivir, and it responds excellently to the oseltamivir. And the second most important drug is steroid. So steroid increases the worsening, improves the hypoxemia, improves the well-being, reduces the SIRS. So steroids are extremely important to improve the viability, improve the mortality of such patients. So usually steroid is given as per the dose of the patient. So if the patient is 70 kg, usually, injection methylprednisolone comes into the strength of 40 milligram. So very commonly 40 milligram twice a day, around 80 milligram is very commonly used, even if the patient is 50 kg, 60 kg, 70 kg, or 80 kg. But the high dose, which we call it as 1 milligram per kilogram, is pretty sufficient. So for around 3 days, we can give twice a day. So as much steroid as the patient's weight, and we can reduce it, taper it over a period of around 5 to 7 days as per the patient response. So the most important treatment is oseltamivir and steroid. And if the patients are dyspneic, definitely non-invasive or invasive ventilation is very much necessary. So this was for now, and thanks for your kind listening, and thank you so much.